meshes have been used for repairs for many, many years, and it's starting to become clear that the basis for using that may have been suspect, and whether the product itself was fit for purpose.
It's a surgical device used to treat a variety of injuries from vaginal prolapse, bladder prolapse to hernia repairs as well.
The meshes are quite stiff, and so they can just be painful just when a patient or a person is walking around and standing and sitting.
The majority of the time, the level of pain and the symptoms that they experience prevent the clients from carrying out their working duties.
There is also the concern that patients were not being consented appropriately when being put forward for the use of these medical items.
The focus of the majority of cases of this nature is on the consent process and whether appropriate informed consent was obtained prior to the surgery and prior to using the mesh implants, and whether the client was appropriately advised of all of the possible risks.
Some outcomes with the use of meshes have been very good. Conversely, there have been some very, very poor outcomes, and it is incumbent upon the medical profession to engage with the patient and make sure that the right decision is made for the right patient at the right time.
Each patient will be dealt with differently. There'll be different treatment options available to every person who sits before a consultant, and what the consultant's responsibility is to make sure that that patient is aware of all treatment options available or are viable for that patient, and let them make an informed decision.
For both hernia mesh repairs and also vaginal prolapse or bladder prolapse mesh repairs, the client can suffer ongoing problems, most usually bladder related, so urinary dysfunction, increased urinary frequency, stress incontinence, also bowel difficulties, difficulty with opening the bowel or increased frequency, also sexual dysfunction. The majority of the time it's simply too painful.
Scar tissue can form around that mesh. That mesh can rub on weaknesses in the walls and the tissues, and it can erode through to other organs, and that is when it can cause damage and pain.
If a client wants to pursue a clinical negligence claim, there are time limits that the client has to be aware of. The standard time limit is 3 years from the date the cause of action accrued, or 3 years from the client's date of knowledge that they potentially had a claim.
The increased volume of inquiries that we've received, it's clear that people have been suffering with these implants for many, many years, and we'll do all we can to help them pursue a successful medical negligence claim.